Thank you, Mr. Chairman. I appreciate the time.
Senator Sheehy.
Thank you, Mr. Chairman. I'll agree with Senator King's comments that, we all care about the veterans here. We may not always agree. And, in the last 5 years, our veteran VA budget has increased by 70%, over 70%. VA employee headcount's increased by 28%. Our veteran population in the country has gone down by over 9%. And yet, as you pointed out, General Bartram, veteran suicide has gone up. Patient wait times have gone up. Call wait times have gone up. Our contract for the veteran healthcare electronic health records is over a decade over schedule now and billions over budget. So all these contracts that are being canceled, I can very much believe that we're not seeing impact in medical care, because it seems like the more contracts we issue, the more money we spend, and the more people we're hiring, the quality of the care and our ability to deliver it is actually decreasing. And our ability to interface with community care and allow our veterans to interact with their community's healthcare that's already there is the best and fastest and cheapest way for us to make sure that if a veteran is in need, a mental health care crisis in rural Montana, when they're hours from a VA hospital, the quickest, best, and cheapest and most effective way for them to get the care they need is not to wait on a phone line for hours on end, not to wait 3+ weeks to get an appointment booked, but to be able to go that day, that minute, to a local care center where they can get what they need. And what we've seen is intentional obstruction for years of the ability for veterans to actually access community care, and that obstructions come from within the VA. Not everybody, not every single person, but there's no question there's been organizational obstruction to accessing private community care for veterans. In a state like Montana, where we have almost 10% of our state are veterans, in a frontier healthcare market, not just rural healthcare, frontier healthcare, to assume that we can build a clinic close enough to every veteran and make sure they have the access in a time of urgent emergency need is fantasy. It is fantasy. They have to be able to access community care, and there's been an intentional obstruction of that within the agency. And the more money we spend and the more contracts we issue, the more people we hire are not solving the problem. It's not. So are we going to solve the problem, or are we going to create jobs? And for me, I'm about mission. Having served in combat like Jeremiah and yourself, I'm worried about what's good for the veterans. And I believe Senator King and everyone else is too. We may not agree, but the data does not lie. And the data shows that despite hiring tens of thousands of extra employees and spending billions and billions upon billions of more money on contracts and people and buildings and brick and mortar, it hasn't improved the situation. So I applaud the efforts of Secretary Collins. Have they been perfect? No. Changing a massive organization is never going to be easy or fast. We're going to make mistakes, but something has to change. The trajectory of how we're dealing with our veteran care model has to change. And this administration is changing that, and I support it. So I thank you for your efforts in doing so. It's hard to change something like this without making some mistakes, and you're going to make enemies. But you've taken a big risk in doing it, and I appreciate it. So that's most of my time. But I will, in the vein of my questions, ask a couple of things specifically to Mr. Workman, since you've been getting all the attention so far. I'll give you a break. Transition assistance, you talked about it. You've done it yourself. I've done it. It's a challenging thing to do. What are you going to do specifically with the TAP program, or I should say transition assistance program with TAP, to make sure that we are building a more sturdy bridge for our veterans as they transition so they can have ready-made careers when they get out?
Thank you for the question, Senator. I think it needs to start a little earlier in the transition process. As you know, a lot of junior folks, when they are making that transition, the last thing sometimes between them and a DD-214 is that check in the box that they went through TAP class. We need to put emphasis on it and make sure the commanders are holding their troops accountable and ensuring that they are attending TAP to begin with. But if confirmed, and I get to DOL vets, we need to take a look at it from the top to the bottom, and there's absolutely room to improve the process. Like I said, I think we need to make sure that we have a seat at the table with the DOD and the VA as we all administer TAP. And I look forward, like I said, if confirmed, to taking a look at it and seeing what we can do to ensure that we can give veterans and their family members good paying jobs when they leave the military, jobs that when they wake up in the morning, they feel good about what they're doing and they can take care of their family. that's what we're going to do.
In a recent Senate discussion, Senator Tim Sheehy, Republican Montana, drew attention to the ongoing struggles veterans face despite massive increases in funding and staffing for the Department of Veterans Affairs, VA. He noted that in the past 5 years, the VA budget has grown by more than 70%, while its workforce has expanded by 28%. During the same period, the nation's veteran population has decreased by 9%. Yet, critical issues remain unresolved. Veteran suicide rates continue to rise, patient and call wait times have worsened, and the VA's electronic health record project is years behind schedule and billions over budget. Sheehy argued that simply pouring more money into contracts, facilities, and staff has not improved outcomes. Instead, he pointed to what he described as intentional obstruction within the VA that limits veterans' ability to access community-based healthcare. In states like Montana, where nearly 10% of the population are veterans and healthcare is often delivered in frontier rather than urban settings, Sheehy said it is fantasy to believe the VA can build clinics close enough to meet every urgent need. For him, giving veterans the ability to seek care in their local communities is the most immediate, affordable, and effective solution. He emphasized that the mission must always come before bureaucracy, questioning whether the current approach is truly about solving problems for veterans or merely creating jobs within the system. While acknowledging that change in an organization as vast as the VA is difficult and mistakes are inevitable, Sheehy praised Secretary Collins for taking risks to shift the direction of veteran care and confronting entrenched resistance. The senator also raised concerns about the Transition Assistance Program, TAP, which helps service members shift into civilian life. Addressing nominee Jeremiah Workman, Sheehy asked how the program could be strengthened to better prepare veterans for meaningful careers. Workman replied that TAP must begin earlier in the transition process, be enforced more strictly by commanders, and undergo a top-to-bottom review with input from the VA and the Department of Defense. His vision, he said, is to ensure veterans and their families can secure stable, well-paying jobs that bring pride and financial security after military service.